Patients and relatives are reacting to the ongoing strike action by resident doctors. The Nigerian Association of Resident Doctors, NARD, on November 1, 2025, went on an indefinite strike to protest unpaid salaries and allowances, poor working conditions, amongst others. Meanwhile, as some say healthcare services have not delayed, others say otherwise. Lydia Adegbaju completes the story.
It is day 13 of resident doctors' strike as the Nigerian Association of Resident Doctors, NARD, proceeded on an indefinite strike over unmet demands, which includes improved welfare, better working conditions, and the implementation of agreements previously reached with the government. Resident doctors refer to doctors in training, which comprises house officers, resident doctor junior registrars, senior registrars, amongst others. Speaking on some of the travails facing the doctors, Dr. Philip Ajibade, the president of the Association of Resident Doctors, Union Chapter, lamented excessive work hours, which he said was endangering the health of doctors. Citing examples of doctors who have died on the job, Dr. Ajibade advocated an end to 48-hour call for doctors, calling it a killer practice.
Because what people don't know is that when you are hypertensive, you can walk now and just fall down, collapse. That's probably cardiovascular stroke. Understand? You have stroke, you can have heart disease, you can have a lot of conditions underlying in your body. So these are doctors, and this comes from unregulated work hours and excessive stress. So what we are saying is that, first of all, now let us stop this idea of doing this 72 hours call. But there's not even about it. 72 hours call is a killer. 48 hours is a killer. We need to stop it totally and off the duty.
But how is this strike impacting patient care in hospitals in Osun State? In a visit to Union Teaching Hospital, Mrs. Cynthia Adeleye, who came for her optical checkup, speaking to Western Spring Television, said the process has been smooth in the 3 times she has come. Similarly, Mrs. Adeyeye, a patient's relative, said though they came in around midnight, they are being properly attended to. The story is the same for Alhaja Mistura Raji and Mr. Kabiru Adebayo, who brought their children to the hospital.
Around doctor attend this one. What then take care dada? That's what I see they be one feedback on so pe boya won da sele kan ma attend this one. Toro rula dey bi by, but I dey bi loru. Wọ́n attend this, so I didn't improvements.
Àrẹ́yàn dá wa lóhùn o, wọ́n try gan-an, wọ́n gbìyànjú, wọ́n dá sẹ́lẹ̀. Bí wọ́n tiẹ̀ ní wọ́n dá sẹ́lẹ̀, wọ́n ṣiṣẹ́, a rí doctor, ara wọn nurses, gbogbo wọn ni wọ́n attend sí wa dáadáa, wọ́n sì tọ́jú wa. Ọmọ mi wá bímọ ni, ó sì bí láyọ̀.
Báwa náà ṣe gbọ́ láàárọ̀ ni, but wọ́n ti dá lóhùn láàárọ̀ yìí. Wọ́n dá lóhùn àti wọ́n ti attend sí wa kan lọ ṣe test náà là ń dúró de result test. Mo ṣe pé normally pé àwọn èèyàn tán ti expect kí wọ́n wọ iṣẹ́ èrò máa ra pọ̀ ńlẹ̀lẹ̀ tó máa jáde wá fún treatment. So wọ́n dẹ̀ ti ní procedure tí wọ́n ṣe kalẹ̀ lẹ́ka wọn tẹ̀lé. Akọ̀rúkọ kalẹ̀ lẹ́ ni àtò ní wọ́n sì ń dá lóhùn.
However, the story was not the same for Alhaji Ahmed Adeyeye, who lamented the delay in healthcare delivery owing to doctors downing tools.
Àwọn bí àwọn student làkàǹkàn rí tí àwọn lọ tí àwọn bọ̀ kọ́sọ̀ àwọn rí doctor gangan àrí wọn kọ́sọ̀ ọmọ ẹ̀ ó yẹ kán ti ṣiṣẹ́ lórí ẹ̀ ká ti rí proof. But àwọn náà àwọn student yẹn ẹlòmíì gan ò mọṣẹ́ wọn kàn fi hàn kọ́ṣẹ́ tí wọ́n fi hàn ṣe kínní ni nǹkan sábẹ́ tí àwọn gún ọmọ yẹn tó pé ojú mi kéré tó wọ́n fi wọ́n ṣe training ni.
Meanwhile, the President, Association Resident Doctors Union Chapter, decried the immense but avoidable stress that patients' relatives go through, saying this would not be the case if teaching hospitals were well funded. He cited this as well as poor working condition as some of the reasons for brain drain in Nigeria's health sector. The resident doctors claim the federal government owes 38 billion naira in salaries excluding allowances and that their salaries have not been reviewed in 16 years. It is, however, hoped that the federal government would call for a dialogue soon with stakeholders in the health sector to resolve the matter so patient care as well as workers' well-being would be prioritized. Lydia Adegbaju, Western Spring